Thank you for tuning in to the Cannabis Currency podcast, sponsored by publiclytradedpodcasts.com. Cannabis Currency provides companies an outlet to share valuable information with a focus on CBD, hemp, and cannabis markets. From testing laboratories to full-scale hemp farming, agricultural, nutraceutical, and pharmaceutical development and production, ancillary businesses and consultants, medicinal and recreational dispensaries, oils, edibles, infused beverages, and more. Cannabis Currency brings to the forefront publicly traded companies on the cutting edge to help heighten your awareness in an ever-expanding market. Here's your host, Marcus Heatherly.
Thank you for tuning in to today's episode of Cannabis Currency. We're excited to spotlight Medical Marijuana Inc. They're trading on the OTC pink sheets under the ticker symbol MJNA. Medical Marijuana Inc. is the first publicly held company vested in the cannabis and hemp space in America. Through its subsidiaries and investment holdings, the company focuses on the development, sale, and distribution of hemp oil and a multitude of associated products for the pharmaceutical, nutraceutical, and cosmeceutical industries. And we're excited to have the company's CEO with us, Dr. Stuart Titus. Dr. Titus, welcome to the show.
Well, it's a great pleasure to be on today, and thank you so much for the opportunity, Marcus.
For those that don't know, Dr. Titus is a PhD and is an innovator who's been involved in the growth of many companies in the cannabis industry. He started his relationship with Medical Marijuana Inc. by becoming its seventh investor. Dr. Titus is also a Wall Street veteran where he was a bond trader for 11 years. Dr. Titus, if you would, please give myself and my listeners a brief background about yourself and your company, Medical Marijuana Inc.
Well, thank you again. Certainly, it's been a great ride since we originated the company back in March of 2009. My background, as you've mentioned, I was a Wall Street bond trader and underwriter for Credit Suisse First Boston. Had a nice 11-year career on Wall Street. But after 11 years, had enough of the fast-paced lifestyle and stress, burnout, etc. So I decided to change gears, and here I found one of my good friends from college, a fellow named Paul Kannaway, was the head physical therapist actually on the PGA Golf Tour. He was doing a very interesting type of low-level electrical current stimulation called microcurrent therapy with many of the top sport athletes, and certainly I thought this would be a wonderful second career for me, so I was able to get some training from Paul and got set up with some therapy equipment after schooling, etc., and had a wonderful series of physiotherapy clinics in the Carolinas. And here I was treating a lot of high-level sport athletes. It was really interesting for me to see that just about to a person, all the contact sport athletes were using cannabis in one form or another to help control pain, decrease inflammation, help with sleep at night. And it was so interesting to me that actually I decided to start attending these what are called medical cannabis symposiums. And these are medical gatherings where people from around the world who've been studying some of the potential benefits of cannabis and been gathered together and presented some of their information, and I was just totally blown away by the tremendous amount of information, study, and research on these extracts from the cannabis plant family called cannabinoids. So when the public company started out in California back in March of 2009, I thought this might be one of the next great growth industries in America, and certainly became involved as an investor back then. And coming from the East Coast, coming out to California, gosh, I couldn't believe how widely accepted cannabis was for its many different uses. People just using it to recreationally, to relax in a similar manner to what they use alcohol, but certainly proving to be significantly safer than alcohol. And then many people using it medicinally, even some of the sport athletes. I just was quite intrigued by this. And basically began a nice relationship with the company that when new management came in March of 2011 and had been focused on hemp and CBD, I moved out to San Diego on a full-time basis and have become involved with the company to a much more significant degree. Back in the spring of 2012, we were credited with bringing the first nutraceutical hemp-based CBD products to U.S. and world markets. Certainly CBD has been a tremendous phenomenon ever since. I think if you look in newspapers, articles, et cetera, magazines, you'll find CBD almost to be everywhere. certainly giving individuals a wonderful way to take advantage of the many benefits of cannabis without necessarily getting the high.
Absolutely.
Quite an appeal to a number of individuals. Over the years, we've developed a fully THC-free version of CBD that's now accepted by the World Anti-Doping Agency, and certainly CBD is allowed for professional sport and Olympic competitions. So I think over time, certainly, we've had some wonderful success, and certainly this huge industry now with passage of the 2018 Farm Bill is certainly becoming a lot more legitimized in the nation. Bringing back of hemp as an industrial crop for the first time in 82 years. Next year, farmers will be able to plant a hemp crop, legalizing and fully distinguishing CBD as separate from marijuana, taking it off the Controlled Substances Act. These are wonderful innovations that will allow individuals to feel more comfortable about using the product. And overall, we do see tremendous growth potential ahead.
Well, you guys, MJNA, and you in particular, Dr. Titus, have been a leader in the CBD space since its start. If you could tell us how you see the continually changing landscape shaping up in regards to its sale in the United States.
Well, certainly there have been a tremendous number of challenges and hurdles to overcome. We're still, even though federal legislation has legalized hemp and hemp CBD, nonetheless, the U.S. FDA is still standing in the way a little bit of the CBD industry. I was recently at hearings they held May 31st.
Yes, I saw that.
In their facility in Baltimore, Maryland, just outside in Baltimore, in Silver Spring, Maryland, and basically was testifying on CBD's inclusion as a dietary supplement. Certainly, this is something that the FDA has said that, well, CBD can't be sold as a dietary supplement or as a food additive. Certainly, we take exception to that and believe that the Farm Bill has legalized this. And I think Senator Mitch McConnell, the author of the Farm Bill, if you will, or the hemp provisions in the Farm Bill, has already spoken with the FDA commissioner about potentially fixing some of the glitches and making CBD available as both a dietary supplement as well as a food ingredient. Now, many U.S. states are actually moving forward with their own legislation just because they see the federal government dragging their feet. So here in California, we have Assembly Bill 228, so AB 228 basically will allow CBD to be sold both as a dietary supplement as well as a food ingredient. And this is something we expect passage over the summer. We do feel many other states will similarly follow course, but obviously we'd love to be on an equal playing field with all the other nutritional and dietary supplements. We really do see that, yes, though, if you use isolated and refined forms of CBD, this has its ability to be considered a medicine. In fact, the FDA has approved a CBD-based medicine as of June 2018, known as Epidiolex. And this is being used for children with very difficult forms of what's called refractory epilepsy, very advanced forms of epileptic seizure disorders that are generally resistant to pharmaceutical intervention. Those individuals with these unfortunate conditions do seem, in many cases, to be helped with the pharmaceutically developed version. Nonetheless, a more natural botanical, lower dose, lower serving size, if you will, version still, we believe, should be available to the general public, just like vitamin C. You don't necessarily need to be sick or have a doctor's prescription to be able to take advantage of the benefits of CBD, how it might support your large internal self-regulatory system known as the endogenous or internal cannabinoid system. Certainly, we believe that many individuals will see great benefit by supplementing their internal self-regulatory system with this particular product.
Well, I think the current market is showing clearly that a large majority of the public is completely in agreement, and the more people become aware and educated about the benefits of CBD, I think you'll slowly see the legislation follow. Switching gears a little bit, can we talk about the international market for CBD? What's your vision for CBD markets in South America, Asia, and Europe?
It's been wonderful to see some developments in these particular markets. We've actually been able to legalize our products into the country of Brazil as of April 2014. So for the past 5+ years, we've been in the Brazilian markets. Certainly, the regulatory authority there saw some tremendous benefit with young children with unfortunate types of epileptic seizures that were not being controlled with your traditional pharmaceutical medications. They saw that our hemp CBD products were effective for some of these children, certainly, and gave us a special import permit to bring our products into the country along with doctor prescriptions. So this has been a wonderful development for us. We're quite excited about our Hemp Meds Brazil operation. Certainly we're including expansion of facilities. We have offices in both Sao Paulo as well as Rio de Janeiro. We do have medical doctors on staff who regularly lecture other medical professionals on the benefits of CBD and the internal endogenous cannabinoid system as well as cannabis-based medicine. So this has been a wonderful addition to our company. In February of 2016, we developed a fully THC-free product, as I previously mentioned, but this product was accepted by the government of Mexico, also for the treatment of refractory epilepsy. So in that country, our products are available by doctor prescription for these young children with health challenges, and certainly it's been wonderful to see many other countries in the Latin American arena now starting to look into CBD. We have operations in Paraguay, and we also do have a little office and a small operations center in Argentina. We're hoping to be able to do a 60-patient adult epilepsy study in the country of Argentina and enroll patients by sometime the second half of the year here.
Well, it's very exciting to see your guys' global vision and meeting the needs in markets literally all over the world, especially of the epilepsy patients and those suffering from like conditions. If you would, talk a little more in detail about Kannaway and how it will position itself for success in the European market for CBD products.
We've had a wonderful resurgence in Kannaway since March of 2016 when we brought in new management talent. We brought in a pedigreed multi-level marketing expert, a fellow named Blake Schrader, who is our CEO of Kannaway and also runs our overall MJNA group operations division. Blake has done some amazing things, being able to resurrect and bring in new products to Kannaway, a new compensation plan, as well as bring in new people, individuals, contacts, and really upgrade the level of professionalism within our organization. We're just in process of upgrading our back office to be able to report and pay people on a much easier basis. Just people can track a great number of their product sales and downline, et cetera, very easily through this new back office. But certainly the expansion into not only throughout the U.S., but also into the European markets, where he's previously had pedigreed success, has been wonderful to see. And certainly many of the leaders have also had good success over in Asian markets with prior multi-level marketing companies. Certainly we're quite excited about the fact that we've had a great bit of resurgence, and certainly think this is going to be a continuing wonderful profit center for the company as time goes along. We've been able to really get in to the financials and the reporting of our company, getting into things such as costs and final cost of goods sold to be able to get a better handle on this. I think some of the improvements in our profit structure have been noticeable over the past quarters, and I believe this is a trend that's going to continue as we continue to upgrade our financial reporting.
The company that we're highlighting today on Cannabis Currency is Medical Marijuana Inc. They trade on the OTC pink sheets under the ticker symbol MJNA. We've had Dr. Stuart Titus with us today. He's the CEO of the company and really an innovator in the medical marijuana and CBD space. Dr. Titus, is there anything that we didn't touch upon that you'd like to mention to our Cannabis Currency listeners and to your investors?
Well, we're quite excited about the growth and development of the CBD industry. Certainly we have 4 divisions now in nutraceutical sales of hemp-based CBD products. 2 of our pharmaceutical partners are early stage, up-and-coming biotech organizations that we believe have tremendous promise. We've been investing back into the space over time. Certainly we're quite excited not only about what our current product line has to offer, but also the huge number of cannabinoids, which now medical science has identified 146 different cannabinoids, and many of these might be the next up-and-coming CBD. For example, CBG, what's called cannabigerol, is kind of the stem cell cannabinoid, if you will. This is the first cannabinoid that the cannabis plant family develops as the hemp or the cannabis crop initiates itself, and then over time certain enzymes might convert this into THC or CBD or many of your other trace cannabinoids. But certainly we are quite excited about some of these trace cannabinoids that are now being able to be grown in a little bit higher concentrations to the point where they may be the next up-and-coming CBDs, if you will. And certainly we think that with a great amount of research that can potentially be done with this huge internal endogenous cannabinoid system with receptor sites widely expressed throughout the human body, that this holds tremendous potential not only for health and wellness, but also for pharmaceutical application. So we really believe that, like Dr. Raphael McCoolin, he's kind of the grandfather of all cannabis-based medicine, a tremendous researcher over from the country of Israel. Dr. McCoolin believes that once cannabis and these cannabinoids are fully developed out, we may be able to replace as much as 40% of our current pharmaceutical medications with something a little bit more natural in terms of its effect. These wonderful cannabinoids do seem to have a tremendous health and wellness effect on the human body, and certainly we're quite excited about some of the research that we've been able to do at a very early stage with our natural botanical products, and believe that there's a great application here as well as for pharmaceutically developed versions of cannabinoids to really change the way we think about health and wellness around the globe.
I would agree 100%, and I would tell you that I'm hopeful that everything you are speaking about comes to fruition in regards to healthcare and the needs being met by non-opioid based, substitutes, if you will, nutraceuticals and things of that nature. Dr. Titus, thank you for your time. Thank you for coming on. We look forward to having you on again in the fall. Thank you for all that you do in the CBD and medical marijuana space. We really appreciate you.
Well, thank you so much for the opportunity today. Really appreciate being on with you.
This audio interview was entirely sponsored and produced by Publicly Traded Podcasts, which is responsible for the content. The opinions and information provided in this audio interview are those of the guests and those of the respective companies that they represent, and do not necessarily reflect those of the team or management of Publicly Traded Podcasts. All listeners of this audio interview are encouraged to do their due diligence and research when planning and executing investment strategies. We strongly recommend seeking the assistance of an investment professional. The guests interviewed may have paid for an extended audio distribution package and are in no way affiliated with Publicly Traded Podcasts or their audio distribution partners.